So now we're going to do a technique for the QL muscle. And this is a positional release technique, which I think works really well for the QL for the pelvic floor. And I'll explain that in a minute. Now, what you're going to have the client do is you're going to have them in side lying. You're going to have them bolstered up a little bit with some pillows, as well as a pillow underneath the legs with the knees bent. That slackens the QL muscle and allows us to have a little more easier access to get inside and get into the QL where I want to go. To access the QL muscle, I like to use my fingertips. And what I'll do here is I'll slowly contact the tissue, and then with a reinforced hand, I'll just slide in slowly. You're working with the breath here. And remember that the client is in a position that helps to slacken this muscle. This is typically a very tight muscle. And what you're looking for here is the possibility of trigger points or tender points. Tender points are going to be things that refer pain more locally, but trigger points, especially the deep trigger points of QL, can relate into the pelvic floor and down into the buttocks. So if you can find trigger points in this area, which some people have, it can provide a sensation of relief for pelvic floor pain. And it's one that not a lot of people talk about, but I really think this technique could help. But it takes time. And it's, once again, a very patient technique. I would say most techniques that have to do with pelvic floor treatment are going to be ones that you have to slowly kind of sink into. Now, as time goes on and the client is in this slackened position, sometimes you'll just reach a barrier and you won't be able to go any further. But other times you'll be able to sink in, and it might take a minute or two, may take 5 minutes, and you'll slowly start to sink down more and more into the tissue. And usually in those kind of deeper recesses of this muscle, of this tissue, is where you're going to find the trigger points that relate into the pelvis. And once you've found them, stick on that trigger point, hold it for about a minute or until the client feels like there's a sensation of relief. And then once they feel the sensation of relief, you can slowly bring your fingertips out of this technique. And then you could do a little bit of massage in the area, a little bit of effleurage, and place some heat on the area as well.